Did you know that surgery after 70 can bring risks most people never hear about? As we get older, our bodies don't respond to surgery the way they used to. Many people think surgery is simply about the procedure itself, but it's so much more than that. It's about how your body reacts to anesthesia, how well you heal afterward, and whether your recovery will be smooth or set you back. If you're between 70 and 85, you've probably already noticed that healing takes longer and your body doesn't bounce back as quickly as it once did. Stress feels a bit stronger and recovery feels a little tougher. But here's the thing, this doesn't mean that surgery is a hopeless ordeal. In fact, with the right preparation, you can recover faster, reduce your risks, and feel more confident going into the procedure. Many seniors who recover stronger and faster than expected aren't just lucky. They made smart choices ahead of time. They understood what their bodies needed and took simple steps that made all the difference. In this video, we're going to walk you through 5 essential things you need to know before undergoing surgery in your 70s or 80s. These aren't just medical facts. These are key steps that can impact your body, your mind, and your recovery. Stay with me to the end, because we're not just talking about physical health, we're talking about protecting your independence, reducing recovery time, and walking into surgery with the peace of mind that you've done everything you can to take care of yourself. Let's get started. One of the most overlooked aspects of surgery after 70 is how your body responds to anesthesia. Many people don't realize that the way anesthesia affects older adults can be very different from younger people. While anesthesia is crucial for keeping you comfortable and pain-free during surgery, it also has a significant impact on how your body heals afterward. As we age, our bodies become more sensitive to anesthesia, and this can lead to longer recovery times and unexpected complications. For instance, after surgery, many older adults experience something called post-operative delirium or confusion, a condition that causes memory problems, disorientation, and sometimes mood changes. This can last anywhere from a few hours to several days and can make the recovery process feel even more challenging. Research has shown that older adults are more prone to this condition, with studies indicating that nearly 40% of elderly patients may experience some level of delirium after major surgery. The brain, in particular, takes longer to recalibrate after anesthesia, and this can leave you feeling groggy, confused, or even agitated. It's important to note that this is not a sign that something went wrong with the surgery, but rather that your brain needs more time and support to adjust. And this is why it's so important to have a conversation with your anesthesiologist before surgery. Don't just assume they've reviewed your medical history. Take the time to ask specific questions. What type of anesthesia will I receive? Is there a lighter or safer option for someone my age? Will I experience any confusion after the procedure, and how long might it last? These questions may seem simple, but they're essential in ensuring that the anesthesia plan is tailored to your body's needs. I remember a man named Gerald who was 78 and scheduled for a routine hip replacement surgery. Gerald had undergone surgeries before, but this time he knew it was important to ask questions and prepare differently. He asked to meet with the anesthesiologist ahead of time to discuss his options. After reviewing his medical history, they decided to use a spinal block instead of general anesthesia. The result? Gerald woke up from the surgery feeling much more alert and recovered much faster than expected. Within an hour, he was already talking to the nurses and asking for lunch. He said, "It was night and day compared to my last surgery. I felt like myself the whole time." The key takeaway here is that even though most surgeries involve anesthesia, there are options available, and you can work with your medical team to choose the one that works best for you. This proactive approach can make a world of difference in how you feel afterward. It's not just about the surgery itself, but also about how you wake up from it and how quickly your body begins the healing process. Another crucial factor to consider is that older adults may metabolize anesthesia more slowly, meaning that it stays in the system longer. This can lead to extended grogginess, nausea, or dizziness. The longer it takes for the anesthesia to wear off, the more difficult it can be to regain full mental clarity and physical coordination, which can affect your ability to move, eat, and engage in physical therapy in the early days of recovery. In fact, studies have shown that older patients are at higher risk for longer anesthesia recovery times, which can delay their ability to begin walking and participating in post-surgery rehabilitation. It's not just about getting through the surgery, it's about getting through the recovery as well. That's why speaking with your anesthesiologist is a crucial step in preparing for surgery. They can adjust the type of anesthesia or provide post-surgery medications to help manage side effects like confusion and dizziness. Gerald's story shows how one conversation with his anesthesiologist made a huge difference. By being proactive, he was able to recover with fewer complications and a faster recovery time. And while not every surgery will offer the option of a spinal block, this kind of conversation can open the door to better alternatives. It's also worth mentioning that your age isn't just a number when it comes to how your brain and body process medications. Older adults often have a slower metabolism, which can mean that medications, including anesthesia, stay in your system longer. This is why your doctors need to know if you've ever had a bad reaction to anesthesia in the past, even if it was years ago. Your medical history, including past surgeries, can offer important insights into how your body might respond to anesthesia this time around. With this information, your doctors can adjust your anesthesia plan to minimize risks and ensure a smoother recovery. In conclusion, the way your body responds to anesthesia is one of the most important factors to consider when preparing for surgery in your 70s or 80s. It's not just about how well you handle the procedure itself, but also about how your body wakes up afterward and begins the recovery process. By discussing your anesthesia options with your care team and making informed decisions ahead of time, you can set yourself up for a quicker, safer recovery. It's one of the best ways to ensure that surgery doesn't hold you back, but instead allows you to heal and regain your independence. So, the next time you're scheduled for surgery, remember that your voice matters in the decision-making process. Don't hesitate to ask questions and advocate for the best options for your body and mind. Now that we've discussed the crucial role anesthesia plays in surgery after 70, let's move on to another key factor in your recovery: how preparing before surgery can make a huge difference. The truth is, most people focus on the day of the procedure itself, but what you do in the weeks leading up to surgery can be just as important, if not more. Those quiet days before the big event are your best chance to prepare your body for the stress ahead. Seniors who make wise choices during this time often recover faster, experience fewer complications, and feel more in control of the entire process. One of the most overlooked factors is nutrition. As we age, we naturally lose muscle mass, which can slow healing and increase the risk of falls or weakness after surgery. But here's the good news. By increasing your protein intake before surgery, you can help your muscles repair faster and support your immune system during recovery. This doesn't mean eating more, but eating smarter. Protein-rich foods like eggs, beans, fish, and even protein shakes can make a significant difference in how quickly your body heals. In fact, studies have shown that seniors who consume more protein in the weeks leading up to surgery experience fewer complications and shorter recovery times. One study published in the American Journal of Clinical Nutrition found that older adults who increased their protein intake by 30 grams per day had a 40% lower risk of post-operative complications. So, by making small changes to your diet, like adding a little extra protein, you can set yourself up for a better recovery. But it's not just about what you eat, it's also about how well you sleep. Many older adults struggle with light or interrupted sleep, but getting deep, restorative rest before surgery is crucial. Sleep is when your body does much of its repair work, and without enough sleep, your immune system becomes weaker, making it harder for your body to heal. Creating a regular bedtime routine and sticking to it, turning off screens before bed, and staying active during the day can help you achieve more restful sleep. In fact, a study from the Journal of Clinical Sleep Medicine showed that patients who got better quality sleep before surgery had lower levels of inflammation and pain after the procedure, which helped speed up their recovery. Sleep isn't just about resting your body, it's about preparing your entire system for the challenges ahead. Movement also plays an important role in preparing your body for surgery. Even if you're not someone who exercises regularly, gentle movement like short walks, stretching, or deep breathing exercises can go a long way in strengthening your circulation, improving your lung capacity, and preventing post-surgical complications like blood clots or pneumonia. Hospitals are increasingly talking about prehab, which is short for pre-surgery rehabilitation. It's not just for athletes, it's for anyone who wants a smoother, safer recovery. Even if you're only able to take a 10-minute walk each day or do some light stretching, it can make a big difference in how your body handles surgery. I want to share the story of a woman named Helen, who was 76 and preparing for abdominal surgery. Her doctor gave her a checklist to follow before her procedure, which included increasing her protein intake, walking for 15 minutes a day, and doing deep breathing exercises. She followed that plan faithfully, and after the surgery, the nurses were impressed by how quickly she was up and moving. They noticed how stable her vital signs were and how little pain medication she needed. Helen herself said, "I treated it like training, and I think that's what helped me get my feet back under me so quickly." She didn't wait for the surgery to be over to start taking care of her body. She prepared in advance, and that made all the difference. It's clear that the better prepared you are before surgery, the smoother your recovery will be. Another important aspect of preparation is hydration. Staying well hydrated before surgery helps your kidneys process anesthesia more effectively and keeps your tissues healthier during recovery. Unless your doctor advises otherwise, it's a good idea to drink plenty of water in the days leading up to surgery. Dehydration can lead to dizziness, nausea, and a longer recovery time, so make sure you're drinking enough fluids. It's a small step, but it can have a big impact. If you take away one thing from this part of the video, I hope it's this. Preparation isn't just about paperwork or packing a hospital bag. It's about giving your body the best possible start before going through something major. You want to step into that surgery room with strength in your muscles, balance in your system, and peace of mind, knowing that you've done everything you can to take care of yourself. In fact, studies show that seniors who take proactive steps to prepare for surgery, such as improving their nutrition, sleep, and physical activity, have a significantly lower risk of complications and a quicker recovery. The more you invest in your health now, the better your body will be able to handle the surgery and heal afterward. So take those few weeks before surgery seriously. Even small choices like eating a little more protein, staying hydrated, or getting some light exercise can make a huge difference in how you feel and how quickly you recover. When you put in the effort to prepare yourself physically, you're not just hoping for a good outcome, you're making it happen. And by the time surgery day comes around, you'll be able to walk in with confidence, knowing you've done everything you can to ensure your recovery goes as smoothly as possible. Now that we've covered how preparation before surgery can enhance your recovery, let's shift our focus to something many people don't consider until it's too late: the medications and supplements you're taking. At 70 or older, it's common to have several bottles lined up by the sink: medications for blood pressure, cholesterol, maybe something for sleep or joint pain, and then there are the vitamins and supplements we take just in case. But here's something many don't realize. Some of these everyday medications, both prescription and over-the-counter, can interfere with surgery and the way your body heals afterward. Certain medications, like blood thinners, even something as simple as aspirin or ibuprofen, can increase the risk of bleeding during surgery. Even some natural herbal supplements, things like ginseng, garlic, or ginkgo, can cause the same issue. Other supplements, like St. John's wort, can interfere with anesthesia or the medications you'll need after surgery. Even something as common as fish oil, which many seniors take for heart health, can affect blood clotting. It's not about scaring you, it's about making sure you understand that some of these everyday items could cause complications you didn't expect. That's why it's so important to have a conversation with your doctor about all the medications and supplements you're taking before surgery. When your surgery is scheduled, bring a complete list of everything you take: prescription meds, over-the-counter drugs, vitamins, herbal supplements, everything. Don't assume your surgeon knows. Don't wait for the nurse to ask you. Be proactive and say, "Here's what I take every day. Should I stop or adjust anything before my surgery?" This simple step can prevent complications that most people never even see coming. Let me share a story about Frank, who was 81, had been taking turmeric supplements for joint pain. He'd been using it for months with no problems. But before his shoulder surgery, he mentioned it to his anesthesiologist. They decided to pause the turmeric 2 weeks before the surgery to reduce his risk of excessive bleeding. After the surgery, Frank was amazed at how smoothly everything went. He said, "I thought it was just a spice, but that conversation may have saved me from a much rougher recovery." Frank's experience highlights the importance of not assuming that something as harmless as a supplement can't affect your surgery. It's also important to think about the timing of your medications. Some need to be stopped days or even weeks before surgery, while others, like blood pressure or heart medications, may need to be continued right up until the morning of. For instance, a study published in the British Journal of Anesthesia found that not adjusting medications like beta blockers, which help control heart rate, before surgery can lead to increased risks of complications, including heart attacks and strokes. By working closely with your doctors to adjust your routine, you can ensure that your body is in the best possible state for surgery. It's not just about stopping medications, it's about making sure everything is in balance to avoid complications. Additionally, be honest about anything you've started recently, even if it was recommended by a friend, neighbor, or found online. There's no shame in this. It's about getting the full picture. For example, you might have recently started taking a new vitamin or supplement to boost energy or improve joint health, but these can sometimes interfere with medications or anesthesia. Even seemingly innocent products can cause unexpected reactions, which is why your doctors need to know everything you're taking. One study published in the Journal of the American Geriatric Society found that seniors who did not disclose their use of over-the-counter supplements were more likely to experience post-operative complications, including delayed wound healing and increased pain. This goes to show that every little detail matters when it comes to surgery preparation. The key is transparency. When your doctors are fully aware of all your medications and supplements, they can create a safer, more effective plan for your surgery. This includes adjusting medications to ensure you're not at risk for dangerous interactions or side effects. And remember, even if you've been taking the same medications for years, your body may change over time. Just because something worked well in the past doesn't mean it's the best choice now. You may need to make adjustments to your routine in preparation for surgery. This could include switching from certain pain relievers or temporarily stopping an herbal supplement that could interfere with anesthesia. Your medical team is there to help guide you through this process, but you have to be proactive and share everything with them. To make sure you get the best possible outcome from surgery, you need to be honest and detailed about what's in your medicine cabinet. That way, your care team can build the safest plan possible for you. It's not just about avoiding complications during surgery. It's about giving your body the best chance to heal afterward. This includes ensuring that you won't have any surprises when it comes to your recovery. And when it comes to recovery, it's not just about your body. It's about your mind as well. If you're concerned about the effects of your medications or supplements on your recovery, don't hesitate to ask your doctor for advice. They can provide you with the support you need and offer alternative options if necessary. The bottom line is, when you prepare your medications and supplements ahead of time, you're taking an important step toward a smoother and safer recovery. It's not just about what you do the day of surgery. It's about the thoughtful, proactive choices you make before you even step foot in the hospital. By being mindful of what you're taking and having open conversations with your doctors, you're giving yourself the best chance for a successful and complication-free recovery. So remember, be proactive, be honest, and take control of your health. Your body will thank you for it. Now that we've discussed the importance of managing your medications and supplements before surgery, let's turn our attention to another critical aspect of preparing for surgery: the support you'll need during your hospital stay and recovery. One thing no one truly prepares you for until you experience it is just how disorienting the hospital stay can be after 70. The unfamiliar lights, the constant noise, the schedules you have no control over, it can all add up, and it's a lot for your body to handle. On top of that, after surgery, your body isn't just healing, it's also trying to find its bearings again. Seniors often feel blindsided by the amount of help they need during recovery, but it's not that they're weak or incapable. It's simply that they weren't prepared for how much support they'd need after the procedure. Recovery at home looks different in your 70s and 80s compared to when you were younger. Simple tasks that were once second nature, getting out of bed, using the bathroom, or even preparing meals, can suddenly feel exhausting or risky. And this is where planning ahead for support becomes absolutely crucial. The truth is, the people who recover the best after surgery are often the ones who set up help before they even step foot in the hospital. They arrange for a family member to stay with them, ask a neighbor to check in on them, or make sure their home is ready for a smooth recovery. They might stock up the fridge with easy-to-prepare meals, clear walkways to prevent falls, and ensure that someone is nearby, not just for emergencies, but because recovery takes a lot of energy, and that energy can run out fast. It's also worth mentioning that the kind of support you need isn't just physical, it's emotional. After surgery, many seniors feel more vulnerable than they expected. You might feel embarrassed to ask for help or frustrated by how long it takes to do basic things that used to be easy. Some people even experience feelings of sadness or anxiety that they can't quite explain. These feelings are all normal, but they also show just how important human presence is during recovery. Emotional support is just as important as physical help. Now, let me introduce you to Carol, a 74-year-old woman who had knee replacement surgery. Carol was always fiercely independent. She didn't want to ask for help, not even from her children. But after her surgery, she found herself struggling more than she had expected. The first night home, she felt disoriented, exhausted, and worried about whether she could handle it on her own. So she called her daughter and asked if she could come by for a few days. Carol's daughter came over, and they set up a simple routine: breakfast together in the morning, short walks in the afternoon, and quiet time in the evenings. It wasn't about doing the chores for Carol. What really made the difference was simply knowing she wasn't alone. She said, "What helped me wasn't the meals or the laundry, it was the presence. Knowing that someone was there made all the difference." Carol's story shows us just how crucial it is to have emotional and physical support during recovery. Even if you don't have family nearby, there are plenty of options available. Home health aides, senior recovery programs, or even volunteers from local churches and community groups can be an incredible resource. And asking for help isn't a sign of weakness, it's a sign of strength. It shows that you're thinking ahead, prioritizing your safety, and making sure your body has the time and space it needs to recover properly. On top of that, the hospital stay itself can be much more challenging for seniors than we often expect. The environment can feel chaotic and disorienting. The lights, the sounds, the constant interruptions, all of these can make it harder to rest and heal. Seniors often find themselves more vulnerable than they anticipated, and it's in these moments that having someone nearby can truly make a difference. The presence of a familiar face or someone to help with the logistics of your recovery can provide immense comfort and reduce feelings of anxiety. In fact, studies show that seniors with good social support during recovery have lower levels of anxiety and depression, and they tend to heal faster. Research published in the journals of gerontology found that emotional support during recovery significantly decreases the risk of complications, including hospital readmission and post-operative infections. So, when you're planning for your surgery, don't just focus on the medical aspects. It's essential to plan for the support you'll need to get through the recovery process. Whether it's asking a family member to stay with you, setting up help from a friend or neighbor, or arranging professional assistance, make sure you're setting yourself up for success. Preparing your home in advance, clearing clutter, setting up a comfortable recovery space, and making sure everything is easily accessible will also reduce the physical strain during your recovery. It's about creating a space where your body can rest, heal, and regain strength. In the end, recovery after surgery is not just about the physical healing process. It's about making sure your emotional and mental health are also supported. The more you plan for this support ahead of time, the smoother and more manageable your recovery will be. You deserve to heal with dignity, comfort, and the peace of mind that you're not doing it alone. So, as your surgery date approaches, don't just focus on packing a hospital bag. Focus on building a solid recovery plan that includes both physical and emotional support. That way, when you come home, you'll have everything you need to recover safely, with the reassurance that you've prepared yourself for the journey ahead. As we've discussed the importance of preparing physically and emotionally for surgery, let's now focus on one final, often underestimated factor in the healing process: your mindset. How you approach surgery mentally can make a huge difference in your recovery. This is not just about being optimistic, but about being intentional, calm, and focused. The reality is, when you're stressed or anxious, your body reacts accordingly. Stress can delay healing, increase pain, and even make you more susceptible to complications. Studies have shown that mental and emotional preparation before surgery can actually reduce the likelihood of complications and shorten your hospital stay. In fact, a study published in the Journal of Pain Research found that patients who approached their surgery with a positive mindset experienced 30% less pain post-operatively compared to those who were anxious or fearful. The mind-body connection is very real, and when you walk into surgery with a calm and focused mind, your body is more likely to follow suit and recover more efficiently. Let me tell you about a woman named Eleanor who was 72 and living alone. She was preparing for gallbladder surgery, which is a fairly common procedure, but one that can still have risks, especially for older adults. Eleanor had always been a worrier, and when she found out she needed surgery, she immediately became anxious about the procedure, the recovery, and how she would manage on her own. She realized, though, that her stress was only making the situation more difficult. She decided to take a different approach. In the weeks leading up to the surgery, Eleanor started practicing relaxation techniques every day: deep breathing, visualization, and meditation. She made it a point to visualize a smooth recovery, imagining herself walking around her house, feeling strong and healthy. She also set some small goals for herself. I want to be able to eat a full meal on day 3, walk around the block on day 5. She kept a journal where she wrote down her fears and hopes. This simple act of journaling helped her process her emotions, and it gave her a sense of control over the situation. On the day of her surgery, Eleanor felt much more at ease than she had anticipated. Her mindset had shifted from fear to acceptance, and that made all the difference. After the surgery, Eleanor recovered quickly, faster than anyone expected. She was up and walking within hours and didn't need as much pain medication as she thought she would. Eleanor's story isn't unique. Research has shown that when patients approach surgery with mental preparation and a sense of control, they tend to experience fewer complications and faster recovery times. The same study I mentioned earlier from the Journal of Pain Research found that people who practiced mindfulness and relaxation techniques had 40% fewer post-operative complications than those who didn't. So it's clear, preparing your mind for surgery is just as important as preparing your body. This doesn't mean you need to be completely free of worry. Natural anxiety is normal, but it does mean that by actively managing your stress, you can give yourself the best chance for a smoother recovery. But how exactly do you prepare mentally? One of the most effective ways is by creating a small, consistent mental routine leading up to surgery. This could be as simple as spending 10 minutes each evening visualizing a successful recovery, where you see yourself moving around with ease, getting back to the things you enjoy, and feeling strong again. Visualization has been proven to reduce anxiety and improve outcomes after surgery. Another helpful tool is affirmations. A study published in Psychology of Health found that patients who used positive affirmations before and after surgery had lower levels of stress, better pain management, and faster recovery times. For example, repeating a simple affirmation like, "I am strong and capable of healing," can help reframe your mindset and bring you peace. Additionally, naming your fear can be an incredibly powerful tool. Many older adults are nervous about saying out loud, "I'm scared," but acknowledging your fear can actually make it easier to move past it. Talking to a trusted friend, a family member, or even your doctor about your concerns can help you feel heard and supported. By verbalizing your anxiety, you give yourself permission to let it go and focus on what you can control. It's important to remember that, like Eleanor, you don't have to go through this alone. If you need help managing your emotions before surgery, reach out to a therapist or counselor. Many hospitals even offer mental health support as part of their pre-surgery programs. You are not weak for needing emotional support. It's a sign of strength to recognize that your emotional well-being matters just as much as your physical health. The stronger your mental and emotional state going into surgery, the better your chances of a smooth recovery. When you walk into that operating room with a calm, positive mindset, your body can follow suit and start the healing process with a sense of peace. To wrap up, let me leave you with one final thought. Mental preparation for surgery isn't just a nice to have. It's a critical component of your overall recovery. It helps reduce pain, shorten hospital stays, and can even prevent complications. So take time to prepare your mind as well as your body. By practicing relaxation techniques, setting small recovery goals, and being open about your fears, you can improve your chances of a speedy, successful recovery. You're not alone in this journey, and your mind plays a powerful role in helping you heal. When your mind is calm, your body will follow, and together, you'll come out of surgery stronger than ever before. As we wrap up, I want to leave you with something simple but powerful. Surgery after 70 doesn't have to be overwhelming, scary, or out of your control. In fact, the more you understand what's ahead, the more confidently you can face it. And confidence, calm, informed confidence, is one of the strongest tools you have for recovery. Whether it's asking about your anesthesia, eating smarter in the weeks before surgery, adjusting your medications, setting up help for your recovery, or preparing your mind to heal, you have the ability to make choices that will support your body, mind, and recovery. Remember, you're not walking into surgery blindly. You're walking in with intention, awareness, and strength. This preparation will not only help you heal faster, but it will also give you peace of mind, knowing that you did everything you could to make this process as smooth as possible. So take a deep breath, ask the right questions, plan ahead, and walk into surgery with confidence. You've got this. If you found today's video helpful, I'd love for you to leave a comment below and share one thing you're going to do differently as you prepare for surgery. Don't forget to like this video, share it with anyone who could benefit, and subscribe to our channel for more valuable insights. Your support means the world to us and helps us keep creating content that informs and inspires you. We look forward to seeing you in the next video. Until then, take care and stay healthy.